Ever wake up feeling like you got hit by a truck, even after a full night's sleep? Your blood sugar's all over the place and you have no idea why. What if I told you the problem isn't just carbs or meds? It's something much simpler. Most diabetics focus on medication and diet but completely overlook one hidden factor: nutrients. The right vitamins can be game changers for your energy, blood sugar, and nerve health. Stick with me and I'll show you exactly what you're missing and how to fix it. Hey, I'm Jessica, and today we're diving into one of the biggest mistakes diabetics make: ignoring key vitamins. I used to think managing diabetes was just about cutting carbs, exercising, and taking meds. Turns out, that's only half the battle. If your body isn't getting the right nutrients, you're fighting an uphill battle. Ever feel drained, foggy, or just not yourself? It might not be your blood sugar, it could be a vitamin deficiency. Unless those blood pressure medications, stick around because I'm going to break it all down for you. The 3 must-have vitamins, how to know if you're missing them, and the best ways to fix it, naturally and effectively. Look, managing diabetes is already tough, but if your body is running on empty, it's 10x harder. Most people think if they just take their meds and watch their carbs, they'll be fine. But what if I told you that's only part of the equation? Your body needs the right nutrients to function properly, and when you're missing them, things start to go wrong fast. Tired all the time, no matter what? That could be low vitamin D. Tingling in your hands and feet? Probably a B12 deficiency. Brain fog, slow healing, heart issues? You might be lacking folate. And here's the scary part: most people don't even know they're deficient until serious damage is already done. I've seen people struggle for years thinking it's just part of getting older, but once they fixed these deficiencies, their energy skyrocketed, their blood sugar stabilized, and they felt like themselves again. Stick with me and I'll show you exactly how to fix this before it's too late. Let's talk about vitamin D. Most people think it's just for strong bones, but for diabetics, it's a total game changer. Think of vitamin D like the gas in your car. Without it, you're not going anywhere. It plays a massive role in insulin function, inflammation control, nerve protection, and even heart health. And yet millions of people, especially diabetics, are walking around with dangerously low levels without even knowing it. So why is vitamin D such a big deal? Well, it helps your pancreas produce and release insulin more efficiently. When your vitamin D levels are low, insulin resistance skyrockets, making it harder for your body to regulate blood sugar. On top of that, vitamin D is a powerful anti-inflammatory. And guess what? Chronic inflammation is one of the biggest drivers of diabetes complications. Low vitamin D levels have been linked to everything from nerve pain to heart disease, kidney problems, and even a weakened immune system. Ever wonder why some people seem to get sick all the time? Vitamin D plays a massive role in your immune response. If you're deficient, your body struggles to fight off infections, and wounds take longer to heal. Now here's the thing: diabetics burn through vitamin D faster than the average person. Why? Because insulin resistance and chronic inflammation interfere with how your body processes and stores vitamin D. High blood sugar also causes frequent urination, which means you're literally flushing this essential vitamin out of your system before your body can use it. And let's not forget, most people just don't get enough sun. Between working indoors, using sunscreen, and just not spending enough time outside, it's no surprise vitamin D deficiency is so widespread. Now let's talk about the warning signs. How do you know if you're low on vitamin D? Here are some red flags. Constant fatigue. You wake up tired, you feel drained all day, and no matter how much coffee you drink, you just can't shake the exhaustion. Muscle weakness and joint pain. Your body feels stiff, your muscles ache, and sometimes even small movements feel harder than they should. Slow wound healing. Got a cut or scrape that takes forever to heal? Low vitamin D might be the culprit.
Frequent infections. If you're always catching colds or getting sick more often than usual, your immune system might not be getting the support it needs. Brain fog and mood swings. Struggling to focus? Feeling down for no reason? Vitamin D plays a key role in brain health and mood regulation. Tingling or numbness in your hands and feet. This is a major sign of nerve damage. And guess what? Vitamin D helps protect your nerves. If any of this sounds familiar, it's time to take action. The good news? Fixing a vitamin D deficiency isn't complicated. In the next section, I'll show you the best ways to boost your levels, naturally and effectively. And here's something even crazier. Studies show that low vitamin D levels are linked to depression, anxiety, and even cognitive decline. Ever feel like your memory just isn't as sharp as it used to be? It might not just be aging, it could be a nutrient deficiency. And for those of you dealing with chronic pain or inflammation, vitamin D is one of the most powerful natural anti-inflammatories out there. People who have struggled with joint pain for years suddenly feel a huge difference just by fixing their vitamin D levels. The truth is, this vitamin does way more than most people realize, and if you're low, your body is paying the price. Alright, so now that we know how crucial vitamin D is, the big question is, how do we fix it? The good news? It's actually pretty simple. But before we get into the best ways to increase your levels, let's clear up a few myths. First, drinking milk is not enough. A glass of milk has about 100 IU of vitamin D, and guess what? Most people need at least 2,000 to 5,000 IUs per day. You'd have to drink 50 glasses of milk daily to get what you need. That's not happening. Second, just stepping outside for a few minutes won't cut it. Vitamin D comes from direct sun exposure, but if you're wearing sunscreen, sitting behind glass, or live in an area with weak sunlight, your body isn't making enough. And if you have darker skin, you naturally produce less vitamin D from the sun, meaning you need even more exposure. Best natural sources of vitamin D. So where should you get vitamin D? Let's start with food. The best sources include cod liver oil. 1 tablespoon gives you more than 300% of your daily requirement. Wild-caught salmon. A 100-gram serving provides about 130%. Sardines with bones. Not only rich in vitamin D, but also a great source of omega-3s. Egg yolks. 2 large eggs give you about 20% of what you need. Mushrooms, if exposed to sunlight. A plant-based option, but only effective if grown under UV light. Now, if you love gourmet food, here's a fun way to boost your vitamin D. Japanese miso-glazed salmon, packed with flavor and nutrition. Norwegian pan-seared cod liver with garlic butter, a powerhouse of vitamin D. Black truffle scrambled eggs with shiitake mushrooms, a fancy and effective way to increase your intake. Supplements, what to take and what to avoid. If food alone isn't enough, supplements can help, but not all vitamin D supplements are created equal. You want to take vitamin D3, cholecalciferol, because it's the most absorbable form. Avoid vitamin D2, it's less effective. Here are 2 solid supplement options. Nordic Naturals Vitamin D3, 1,000 to 5,000 IU per soft gel. Highly bioavailable and trusted. Thorne Research Vitamin D K2, 5,000 IU per capsule. Includes K2, which helps your body use vitamin D properly. What not to do. Some foods and habits actually make vitamin D deficiency worse. Processed vegetable oils, soybean, sunflower, canola, increase inflammation and block vitamin D absorption. Sugary foods and refined carbs deplete magnesium, which is needed to activate vitamin D. Excess alcohol damages liver function, making it harder to process vitamin D. High phytate grains, whole wheat, brown rice, bind to minerals, reducing absorption. Take action today. If you've been dealing with fatigue, slow healing, brain fog, or nerve issues, now is the time to fix your vitamin D levels. 1. Check your symptoms. Do you have any signs of deficiency? 2. Adjust your diet. Add vitamin D-rich foods and remove blockers. 3. Consider supplements. Choose high-quality D3 options. 4. Get outside, at least 15 to 30 minutes of direct sunlight daily. Your body will thank you for it. Trust me, Once you get your vitamin D levels up, you'll feel the difference. More energy, better focus, and even more stable blood sugar. Let's get to it. Alright, let's talk about vitamin B12, one of the most overlooked yet essential vitamins for diabetics. If you've been feeling tired, foggy, or noticing tingling in your hands and feet, you need to hear this. Why are diabetics at high risk for B12 deficiency? If you're taking metformin, pay close attention. This common diabetes medication is blocking your body's ability to absorb B12. Yep, the very thing helping you control blood sugar is also depleting a vitamin that your nerves and brain desperately need. And it gets worse. High blood sugar damages the stomach lining, making it harder to absorb B12 naturally from food. On top of that, as you age, your stomach produces less acid, which is needed to extract B12 from food. So if you're over 50 and diabetic, you're even more at risk. Symptoms of B12 deficiency. What to watch for. Tingling or numbness in hands and feet. One of the biggest red flags. If you feel like your feet are falling asleep often, that's a sign your nerves are struggling. And if left unchecked, this can lead to permanent nerve damage. Extreme fatigue. If you wake up exhausted, struggle to get through the day, or feel drained no matter how much you sleep, low B12 could be the culprit. Brain fog, memory problems, and trouble concentrating. Ever walk into a room and forget why you're there? Feel like you're losing your sharpness? That's often a sign your brain isn't getting enough B12. Shortness of breath and dizziness. B12 is crucial for red blood cell production. Without enough, your oxygen levels drop, leaving you feeling weak and lightheaded. Depression, mood swings, or anxiety. B12 plays a major role in neurotransmitter production. If you've been feeling down for no reason, it might not be just stress. Your brain could be starved of B12. The dangerous part? It sneaks up on you. B12 deficiency doesn't happen overnight. It builds slowly over the years. One day you feel a little more tired. A few months later, your hands feel a bit numb. Then brain fog kicks in. Before you know it, you're struggling with neuropathy, cognitive decline, and energy crashes. And here's the scariest part. Many people are misdiagnosed because these symptoms look like aging, stress, or just part of having diabetes. But in reality, it's something you can fix. Stick with me, because in the next section I'll show you exactly how to restore your B12 levels, the best foods to eat, and supplements that actually work. And here's something most people don't realize. Low B12 can also mess with your digestion. If you're dealing with bloating, nausea, or unexplained weight loss, it could be related to B12 deficiency. Your gut needs B12 to function properly. And when levels drop, your entire digestive system suffers. I've had people tell me they were misdiagnosed with IBS or acid reflux when all they really needed was more B12. That's why it's so important to recognize these signs early, before it leads to bigger issues. And here's something most people don't realize. Low B12 can also mess with your digestion. If you're dealing with bloating, nausea, or unexplained weight loss, it could be related to B12 deficiency. Your gut needs B12 to function properly, and when levels drop, your entire digestive system suffers. I've had people tell me they were misdiagnosed with IBS or acid reflux when all they really needed was more B12. That's why it's so important to recognize these signs early, before it leads to bigger issues. Now that we know how dangerous a B12 deficiency can be, let's get to the good part, how to fix it. The best way? Food first, supplements second. The best natural sources of B12. Beef liver. This is the king of B12-rich foods. Just 100 grams gives you 3,500% of your daily needs. Clams. If you love seafood, clams pack an insane 4,000% of your daily B12 in just 100 grams. Sardines. Not only do they have B12, but they're also rich in omega-3s. great for heart health. Salmon, a fantastic source of both B12 and protein. Eggs. 2 large eggs give you about 25% of your daily B12. Looking for gourmet options? Try these. French foie gras with truffle sauce, a luxury food that's packed with B12. Japanese uni, sea urchimi, a super concentrated B12 powerhouse. Lobster thermidor, a fancy but highly effective way to get your B12 fix. What if you don't eat meat? Unfortunately, B12 is only found in animal-based foods. If you're vegetarian or vegan, you'll need a supplement. There's no way around it. And don't rely on plant-based B12 fortified foods like cereal. They use B12 analogs, which your body can't absorb properly. The best B12 supplements, what works and what to avoid. Not all B12 supplements are the same. Cyanocobalamin, cheap and common, but not well absorbed. Skip it. Methylcobalamin, the best form. Highly absorbable and supports nerve repair. Adenosylcobalamin, great for energy production. Here are 2 highly recommended options. Jarrow Formula's Methyl B12 5,000 mg per lozenge dissolves under the tongue for better absorption. Thorne Research Methylcobalamin 1,000 mg per capsule. A clean, effective option. What not to do. Some things actually make B12 deficiency worse. Avoid these. Excess alcohol damages the stomach lining, reducing absorption. Acid-reducing meds, PPIs like omeprazole, lower stomach acid, which is needed for B12 absorption. Refined sugar and junk food increase inflammation, making it harder for your body to hold on to nutrients. Take action now. If you're dealing with fatigue, nerve pain, brain fog, or mood swings, don't wait. Here's what to do next. 1. Check your symptoms. Are you feeling any of these warning signs? 2. Adjust your diet. Add in B12-rich foods and cut out B12 blockers. 3. Consider a supplement, especially if you're on metformin. The sooner you fix your B12 levels, the better you'll feel. Trust me, people who correct their B12 deficiency often feel the difference within weeks. More energy, clearer thinking, and less nerve pain. Don't ignore this. Take action today. I've heard stories from people who thought their nerve pain was just a diabetes thing, but after fixing their B12 levels, the tingling and numbness improved dramatically. And it's not just about feeling better. B12 protects your nerves long-term, preventing permanent damage. It's a small change that can make a big impact on your health and quality of life. So if you've been experiencing any of these symptoms, start making changes today. You won't regret it. I've heard stories from people who thought their nerve pain was just a diabetes thing, but after fixing their B12 levels, the tingling and numbness improved dramatically. And it's not just about feeling better. B12 protects your nerves long-term, preventing permanent damage. It's a small change that can make a big impact on your health and quality of life. So if you've been experiencing any of these symptoms, start making changes today. You won't regret it. Alright, let's talk about folate, vitamin B9. The unsung hero of your body's repair system. Most people don't realize how critical folate is, especially for diabetics. Why do diabetics need folate? Folate is like the construction worker of your body. It helps repair DNA, supports red blood cell production, and keeps your brain sharp. Without enough folate, your body struggles to heal itself properly. But here's where it gets tricky. Diabetics lose folate faster than the average person. Why? High blood sugar increases inflammation and oxidative stress, which disrupt folate metabolism. And if you're on metformin, that medication blocks folate absorption, making deficiency even worse. The result, your body is breaking down faster than it can repair itself. Symptoms of folate deficiency. Are you missing this critical nutrient? Chronic fatigue. Feel like your energy tank is constantly running low? weaker muscles. Your strength isn't what it used to be, and simple tasks feel harder. Slow wound healing. Cuts, bruises, or sores take forever to heal. Brain fog and forgetfulness. Struggling to concentrate, can't remember where you put your keys. Poor circulation and cold hands-feet. Your blood isn't flowing as efficiently as it should. Mood swings and increased anxiety. Folate is crucial for neurotransmitter production, affecting your mood. The dangerous part? Many people confuse this with aging. Folate deficiency doesn't hit you overnight. It sneaks up on you, little by little. First, you're just a little more tired than usual. Then, you start forgetting small things. Before you know it, you're dealing with anemia, poor circulation, and increased risk of heart disease. And the worst part? Many doctors overlook folate deficiency. I've heard stories of people who thought they were developing early dementia, only to find out they were just low on folate. Once they corrected their levels, their focus came back, their energy improved, and they felt like themselves again. Stick with me, because in the next section, I'll show you exactly how to restore your folate levels, the best foods to eat, and supplements that actually work. And here's something even more alarming. Low folate levels are directly linked to an increased risk of stroke and heart disease. If you've ever been told your homocysteine levels are high, that's a red flag. High homocysteine damages arteries, increasing the risk of blood clots and cardiovascular issues. I've seen people who thought their high blood pressure was just part of getting older, but after fixing their folate levels, their numbers dropped dramatically. It's a simple fix that can literally protect your heart and brain for the long haul. And here's something even more alarming. Low folate levels are directly linked to an increased risk of stroke and heart disease. If you've ever been told your homocysteine levels are high, that's a red flag. High homocysteine damages arteries, increasing the risk of blood clots and cardiovascular issues. I've seen people who thought their high blood pressure was just part of getting older, but after fixing their folate levels, their numbers dropped dramatically. It's a simple fix that can literally protect your heart and brain for the long haul. And here's something even more alarming. Low folate levels are directly linked to an increased risk of stroke and heart disease. If you've ever been told your homocysteine levels are high, that's a red flag. High homocysteine damages arteries, increasing the risk of blood clots and cardiovascular issues. I've seen people who thought their high blood pressure was just part of getting older, but after fixing their folate levels, their numbers dropped dramatically. It's a simple fix that can literally protect your heart and brain for the long haul. Now that you know how important folate is, let's get to the real question. How do you fix it? The answer is simple. Eat the right foods and supplement smartly. The best natural sources of folate. Beef liver. This is the absolute best source. Just 100 grams gives you 140% of your daily need. Spinach. A 100-gram cooked serving provides about 65% of your daily folate. Lentils. A fantastic plant-based source. A 100-gram serving gives you 90% of your daily intake. Asparagus. Rich in folate and fiber. Great for digestion. Avocados. Not only delicious, but packed with essential vitamins. Looking for a gourmet way to increase folate? Try these. French duck liver pâté, a luxurious way to boost folate levels. Truffle-infused risotto with asparagus and spinach, packed with folate and bursting with flavor. Japanese miso-marinated black cod with edamame puree, a perfect combination of folate and omega-3s. What if food isn't enough? Let's be real. Not everyone eats liver or fancy truffle risotto. And if you're on metformin, your body is likely struggling to absorb folate properly. That's where supplements come in. But not all folate supplements are the same. Avoid synthetic folic acid. Many cheap multivitamins contain folic acid, which is harder for your body to use. Instead, look for methylfolate 5-MTHF. This is the most bioavailable form and works fast. Here are two of the best options. Thorne Research 5-MTHF, 1000 milligrams per capsule, highly absorbable and great for daily use. Pure Encapsulations Folate, 800 milligrams per capsule. A clean, effective choice for boosting levels quickly. What not to do. Avoid processed grains like white rice and white bread. They strip away folate during refining. Cut back on alcohol. It interferes with folate metabolism and makes absorption harder. Limit sugary processed foods. They increase inflammation and make it harder for your body to use folate properly. Take action now. If you're struggling with fatigue, brain fog, nerve pain, or poor circulation, don't ignore it. Here's what to do next. 1. Check your symptoms. Are you experiencing any signs of deficiency? 2. Adjust your diet. Add folate-rich foods and remove absorption blockers. 3. Consider supplements, especially if you're on metformin. Fixing your folate levels can be a total game changer. You'll feel more energized, think more clearly, and even reduce your risk of heart disease. Don't wait. Take action today. I've seen people who thought they were just getting older suddenly regain their energy and focus after fixing their folate levels. It's amazing what the right nutrients can do. If you've been dealing with constant fatigue, it's time to take this seriously. Your body can't function properly without enough folate. So, start making these small changes today and see the difference for yourself. I've seen people who thought they were just getting older suddenly regain their energy and focus after fixing their folate levels. It's amazing what the right nutrients can do. If you've been dealing with constant fatigue, it's time to take this seriously. Your body can't function properly without enough folate. So start making these small changes today and see the difference for yourself. I've seen people who thought they were just getting older suddenly regain their energy and focus after fixing their folate levels. It's amazing what the right nutrients can do. If you've been dealing with constant fatigue, it's time to take this seriously. Your body can't function properly without enough folate, so start making these small changes today and see the difference for yourself. We've covered a lot, so let's break it down one last time. If you're diabetic and feeling tired, foggy, or dealing with nerve pain, these 3 vitamins aren't optional, they're essential. Vitamin D, the sunshine vitamin. It helps regulate insulin, reduces inflammation, and supports nerve health. Vitamin B12, the energy booster. If you're low, you might feel drained, have tingling hands and feet, or struggle to think clearly. Folate, vitamin B9, the repair vitamin. It keeps your brain sharp, your heart strong, and your blood flowing properly. The truth? Most diabetics are deficient in at least one of these. And that's why managing diabetes feels harder than it should. But here's the good news. You can fix this. Many people who address these deficiencies see a huge difference within weeks. More energy, clearer thinking, less pain, a body that actually functions the way it should. So don't wait until things get worse. Start today. Your future self will thank you. I've seen people who thought they were just getting older regain their energy, feel sharper, and even sleep better just by fixing these deficiencies. Your body is constantly working to heal and function, but it needs the right fuel to do it properly. Imagine trying to run a marathon on an empty tank. You wouldn't get very far, right? That's exactly what's happening inside you if you're missing these key vitamins. The best part? Making these changes doesn't have to be complicated. A few simple tweaks to your diet, the right supplements, and a little consistency can make all the difference. Alright, now it's your turn. If you've been dealing with fatigue, brain fog, nerve pain, or just feeling off, this is your wake-up call. Your body is trying to tell you something. Don't ignore it. Step 1. Take a moment and think. Do any of these symptoms sound familiar? Step 2. Start making small changes today. Add vitamin-rich foods to your meals. Cut out the things that block absorption. Step 3. If needed, find a high-quality supplement to fill in the gaps. Remember, managing diabetes isn't just about medication. It's about giving your body what it needs to function properly. So, what's one thing you're going to change after watching this? Let me know in the comments. I read every single one. And if this video helped you, don't forget to hit that like button and share it with someone who needs to hear this. Subscribe for more game-changing health tips, and I'll see you in the next video. Stay strong, stay healthy, and take control of your health today. I've seen people who thought they were stuck with low energy and constant pain, only to turn things around by making simple, consistent changes. It doesn't take a complete lifestyle overhaul, just small, smart adjustments. Your health is in your hands, and you have more power than you think to improve it. So take that first step today, and don't look back.